Alright, hello.
Hello.
My name is Caroline. I'm going to be the nurse today. I'm going to be doing a full body assessment on you. Alright, can you tell me your name, please?
Robert Milner,
Okay, and date of birth.
October 2nd, 1984.
Thank you. And what year is it right now?
2019.
Okay, and where are we?
St. Petersburg, Florida.
And what's this building?
It is Westport, Colony.
Okay, and I'm just going to ask you to do a quick little math problem. Starting at 4, can you add on, or starting at 0, can you add on 4 for me until I tell you to stop?
Okay. 0, 4, 8, 12, 16, 20.
Okay, thank you. Alright, so today we'll be doing a full body assessment. These are all the tools I'll be using. Halfway through we'll get you laying on the bed, okay? Alright, so we're going to begin. So I'm first going to begin with skin. I'm just going to inspect skin, look for any masses, lesions, wounds, dryness, color, anything like that. Next I'm going to use the back of my hands and feel temperature. Palms of my hands and feel texture. And lightly pinch and feel turgor. Alrighty. Now we're going to look at the scalp. I'm going to inspect the scalp. I am inspecting for color of the hair, hair distribution, baldness, flakiness, anything like that. I'm then going to palpate the scalp. Alright, now we're going to move to fingers and toenails. I'm going to look at your fingernails and toenails. I'm looking at the cuticles for any cracks, any ridges, anything like that. I'm going to ask you to put the two fingers together like this. And I'm going to look, and I do see some light coming through, so there's no clubbing going on. And then lastly, I'm going to check capillary refill. Alright, so I'm just going to use a little bit of hand sanitizer. Okay, so we're going to move to the face and neck. I'm first just going to inspect for symmetry, masses, lesions, anything abnormal. I'm then going to palpate. I'm going to palpate the sinuses and the TMJ joint. Please open and close your jaw. No popping or clicking. I'm then going to test the facial nerve. Have you raise your eyebrows, scrunch your nose, puff out your lips, purse your lips, and smile. Great. Okay, now we're going to test the trigeminal nerve. First, I'm going to use this cotton ball. I'm going to have you close your eyes. Every time I touch your face, say yes.
Yes. Yes. Yes. Yes. Yes.
Okay. Also, to test the trigeminal nerve, I'm going to palpate your masseter muscles and have you clench and unclench your jaw. Great. Now we're going to move to the neck. I'm just going to inspect the neck. I'm going to inspect the trachea to see if it is midline and look for tracheal tug. And I'm going to inspect for JVD, which is not present. Now I'm going to palpate the thyroid. I'm going to have you take a sip of water and hold it in your mouth until I tell you to swallow. Okay? Alright, and then let's do it again. Okay, great. Alrighty. Now I'm going to palpate all 9 lymph nodes. Okay. Last, I'm going to have you look left, look right, look forward, shrug your shoulders. Okay, and then we're going to do resistance with that. Look left, look right, and shrug your shoulders. Okay, now we're going to move on to the eye portion of the test. So I'm first just going to inspect your eyes. I'm looking at your eyebrows, eyelids, irises, cornea, sclera. Next I'm going to palpate around the eye socket. Okay, now I have my Rosenbaum card. I'm going to have you cover your left eye and read to me the bottommost line that you can see.
P, D, T, N, U, H, Z.
Okay, and then we will do it with the other eye.
P, D, T, N, U, H, Z.
Great. Alrighty. Now we're going to do different vision tests. So first, I'm going to have you look at my finger and cover your left eye and uncover. Okay, and then cover your right eye and uncover. Okay, now I'm going to shine this on your chin, look at my nose, and I'm going to look and see how it's reflecting. It is equally reflecting in your eyes. Now we're going to test peripheral. So again, cover your left eye and look at me, my nose, and tell me when you see my finger.
Yes. 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 Yes.
Okay. Try the other eye.
Yes. 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 Yes.
Okay. Now you're going to look at my finger again, and we're going to test these 6 cardinal fields. Great. Now we're going to test lid lag. Again, follow my finger down. Okay. Now I'm going to have you look at my nose, and I'm going to look at pupil reaction. Okay. Okay, and then try to focus as far away as you can, and then focus on my finger. Great, and accommodation is equal as well. Now we're going to move on to ear, nose, and throat. I'm first just going to inspect your ears, look behind the ears for any lesions, and I'm going to palpate the ears. Next, we're going to be doing the whisper test. I'm going to stand back here, cover your left ear, and I'm going to whisper some things to you.
ABC.
Okay, and then we will do the other ear.
1, 2, 3.
Thank you. Alrighty. Now we're going to be doing the Weber test. I'm going to hit this, and I'm going to place it on your head. You're going to tell me if you hear it more from your left, your right, or both.
From both.
Okay. Now we're going to do the Renee test. I'm going to hit it again, place it here. You're going to tell me when you stop hearing it. I'm going to change the position, and then again, you're going to tell me when you stop hearing it.
Stop. Stop.
Okay. I'll do this ear.
Stop. Stop.
Okay. And the air conduction should be twice as much as the bone conduction, which is what we saw today. All right, so now I'm going to be looking at your nose. I'm looking at the bridge of the nose for any deviation. I'm going to look in your nostrils for any polyps. Okay, and then I'm going to palpate the nose. All right, now I'm going to look at the mouth. I'm going to look at your lips for any cracks, lesions. I'm going to have you open your mouth. I'm going to look at the teeth for any dental caries. Look at the soft palate. Look at the tongue for any lesions. I'm going to have you say ah. The uvula is midline. Now I'm going to have you stick out your tongue and move it left to right. Okay, and then I'm going to have you do that again. I'm going to look at the base of the tongue for any lesions. Okay? Okay, great. Alrighty, so now we're going to be moving to the chest and lungs. I'm going to have you remove your gown for this assessment, please. Alrighty, so before we get started, if I were to hear anything abnormal, we would test for bronchophony, egophony, and whispered pectoriloquy. Okay, so first, we'll just inspect the front of the chest. I'm looking at respiratory rate, accessory muscle use, any bony abnormalities, any sort of lesions or masses. I'm then going to palpate. Okay, and then I'm going to auscultate. Alright, some deep breaths for me. going to move to the posterior chest. Again, I'm just going to inspect, looking at respiratory rate, accessory muscle use, any abnormalities. Next, I'm going to palpate. Okay, now I'm going to test for a tactile fremitus. Please say 99.
99. 99.
Okay, and then I'm going to test for thoracic expansion. So take a deep breath for me. Great. Alrighty, now I'm going to auscultate the lungs. Alrighty. Before auscultation, I should have percussed, but I'm going to go ahead and do it now. I'm going to percuss over air spaces. I should be hearing resonance. Okay, lastly, I'm going to test for costovertebral angle. I'm going to lightly tap. Just tell me if you feel any pain. Any pain?
No.
Okay, great. So I'm going to have you face forward again. We will spin this around. So next I'm going to be moving to the heart and cardiac. I'm first just going to point out the 5 regions that I will be assessing, and then we'll have you lay on the bed and we'll go from there, okay?
Okay.
So I'm going to start on the right sternal border, second intercostal space, aortic, left sternal border, second intercostal space, pulmonic, left sternal border, third intercostal space, Erb's point, left sternal border, fourth intercostal space, tricuspid, and mid-clavicular, fifth intercostal space, mitral. Alrighty, so I'll have you lay on the bed. Please, we will move this, and then I'm just going to check my camera angle to make sure we can see what we're doing. Alrighty. So, to assess the heart and cardiac system, I'm first just going to inspect the chest. I'm looking for vibrations, thrills, heaves, anything like that. I'm then going to palpate those 5 areas. Alright, next I'm going to listen with my stethoscope. I'm first going to listen with my diaphragm, and then I'm going to listen with the bell of the stethoscope. Alrighty. As I was listening for S1 sound, which is the closure of the atrioventricular valves, S2 sound, which is the closure of the semilunar valves. If I heard a systolic murmur, it would be after S1. If I heard a diastolic murmur, it would be after S2. If I were to hear anything abnormal, I would have the patient sit up or lay left lateral to bring the heart closer to the chest wall to better hear the noises. Next, I'm going to use the bell of my stethoscope, and I'm going to listen to the temporal and carotid arteries. Alrighty. Now I'm going to palpate all of the arteries. I'm going to start with temporal, carotid, one at a time. 2 if I don't like the patient. Just kidding. Alright, then we'll do radial. brachial, popliteal. Okay, other leg please. Alrighty, dorsalis pedis and posterior tibial. Great. Alrighty. Now we're going to be going to the abdomen. First, I'm just going to be inspecting the abdomen. I'm looking at contour, peristalsis, any sort of pulsations, if the patient is distended. Next, I'm going to auscultate, and I'm going to listen to all 4 regions, quadrants. Alrighty. Next, I'm going to percuss the abdomen. I should be hearing timpani sounds. Great, now I'm going to lightly palpate. Let me know if you have any pain anywhere. Okay, now I'm going to palpate the aorta. I'm feeling for pulsations and for width. Okay, now I'm going to palpate deeper. Let me know if I cause any pain to you. Alright, now I'm going to palpate the liver. So take a deep breath for me. Okay, can't palpate, can't feel anything, so that's great. Now I'm going to palpate kidney. Take a deep breath. Okay, and then we will do the other side. Okay, great. Can't feel anything, so we're good there. Now we're going to move to musculoskeletal system. I'm going to test the range of motion of your hips first. So I'm going to have you take your right leg and swing it out for me and cross it over your body. Great. Now we'll do it with the left leg. Swing it out and cross over your body. Okay? Now please take that knee and bring it to your chest. Okay? Great. And now the other knee to your chest. Great. Okay, you're going to take this foot and put it on top of this knee and bring this knee outwards. Let it fall. Great. Put this foot on the bed and now bring it in. No. Keep it up and bring this knee inwards. Great. Okay, straighten this leg. So we're going to bring this foot to this knee. Let this knee fall outwards. Okay. Put this foot on the bed and let this knee fall inwards. Great. You can straighten it. Now we'll do some strength, so push to resistance. Great. And now this leg. Great. Okay. I'm going to have you sit on the edge of the bed. Okay. So we're first going to test neck. So bring neck to chin. Bring it back. Look left. Look right. Left ear to left shoulder. Right ear to right shoulder. Great. Now we're going to test strength of the neck. So resistance and resistance. Great. Now we're going to do shoulders. So you can do exactly what I'm doing. You're going to bring your arms above your head and down and cross in front. Great. Now you can bring your arms to the small of your back and bring your arms above your head, behind your head. Perfect. Now we're going to test strength of shoulders. So arms straight out, push against, and push against. Great. Now we're going to test your elbows. So arms straight out. We're going to curl your arm down, palms up, palms down, and bring it back up to this position, and then we will test strength, pull, and push. Great. Now we're going to test your breasts. So arms straight, push your hands down, hands up, and then we will test resistance. So push and push. Great. Now we're going to go to your knees. So you can relax your arms. I'm going to have you kick out this leg, kick out the other leg, and then we will test resistance. So push and pull. Great. Now we're going to go to ankles. So we can lift one leg up at a time, so they'll be in the camera view. Push, flex, and then, yep. And we'll go, and great. And then we'll do the other leg. And resistance, and resistance. Great, now I want you to bring your soles of your feet together as much as you can, and apart. Great. Okay. I'm going to have you stand up now and face the other direction. Keep your leg as straight as you can and kick back that leg. Okay? And the other one? All right, perfect. We'll have you face forward. I'm going to have you bend over and try and touch your toes, or as much as you can. Okay? And then I'll have you bend backwards for me. Great. Okay. Now I'm going to have you keep your hips forward and move your shoulders to the left. Okay, and now we'll do it to the right. Great. Now look forward again and test the oblique. Perfect, and then we'll go down the other way. Great, alrighty. Mr. Milner, thank you for being a part of my assessment today. You passed, you did great, everything looked great, and that's it. Thank you.
Thank you.